Hi, I'm Chris Little from KFI AM 640. Thanks for joining us today. We are talking with Ali Santore. She's the Vice President of Government and Public Affairs for Providence St. Joseph Health, and we are talking about dreamers, immigrants, and being a voice for the voiceless. Ali, thanks for coming.
Thanks so much for having me. So
Appreciate
happy
it.
to be here.
Tell me a little bit about your job, or a lot about your job.
Well, it's a big job, but I'm blessed to be able to do it. So I lead interface with our government officials across 7 states and in Washington, D.C. So all of our policy work, all of our regulatory work, and our efforts to advance public policy to realize our system's vision of health for a better world. In a nutshell, that's what it is.
And what is your system's vision in health for a better world?
So Health for a Better World really means that we will, as an organization, the third largest not-for-profit healthcare organization in the country, we will wake up every day trying to improve the lives of the people that we serve in the communities where we are and across the world. So that includes improving their health outcomes, including improving their emotional and spiritual well-being, improving the status of our common home, the earth. So we're even involved in that in environmental stewardship, improving public policy to root out injustice, improving affordable housing. So there are so many things that we do. When we say health, it's not just your physical health. We are really looking at how we improve the whole person healthcare for people.
And I know one of the focuses you have is on immigration. And can you tell me why Providence St. Joseph Health focuses so heavily on immigration?
Sure. Yeah. So it's really in the tradition of our sisters. So we were founded by the Sisters of Providence and the Sisters of St. Joseph. They have in their tradition, part of our heritage, a calling to speak up on behalf of those who are marginalized. We are a nation of immigrants. We are an organization of immigrants within Providence St. Joseph Health. So we feel that we have to be that voice on behalf of the voiceless, to speak up on behalf of the poor and vulnerable. And in many cases, immigrants are the most poor and vulnerable among us.
And how have you done that? How have you advocated for people affected by recent decisions such as the travel ban, DACA, and even, kids being separated from their families at the border?
Well, unfortunately, there have been ample opportunities for us to advocate on behalf of immigrants. We have seen so many policies that are fundamentally against our values as an organization, our values of justice, compassion, and dignity in particular. So just to take the first out of the gate advocacy that we did was against the travel ban. The travel ban was issued shortly after the president's first term began in January of 2017. We had not gotten involved in this sort of issue in a very vocal way. When the travel ban was issued, I had such a fundamental feeling in my heart. I was in Washington, D.C. The rest of our organization, the heart of it, is in Seattle. I saw it come out, and I knew it just was so antithetical to who we are in terms of our culture as an organization and what our culture should be as a society of welcoming immigrants, that long tradition of welcoming immigrants that we have. So I texted our lead communication specialist and our CEO in all caps and said, what are we going to do? We cannot stand by. Our voice is too big, and we have a responsibility to speak up on behalf of those who can't speak for themselves. So in that instance, with just the travel ban, our CEO weighed in with all 37 members of Congress that we across our footprint who represent our ministries, our healthcare facilities, and then also issued a blog opposing the travel ban and a public statement. And that was really the first time that we had been, some people say, out on a limb on these sort of issues, but we are so committed to advancing social justice that it's the right thing to do.
And you have a very diverse, workforce, and a lot of these people have, some of them, I guess, are dreamers and have come from these 7 countries affected by the travel ban. What are some of their concerns or reaction to, what's been going on recently?
Absolutely. So, we stand in solidarity with we call them caregivers. That's all of our employees. We have 119,000 across our organization. 300 of them were impacted directly by the travel ban. We have 147 dreamers, 8 of which have not been able to return to work. So I know that's a small number given 119,000, the scope, but that still impacts our culture. It still impacts morale. It still runs against who we are. So aside from those directly impacted, we have also felt this culture of fear just among our organization, among our caregivers. Caregivers have emailed our chief executives saying, I'm fearful for myself, for my family, not only related to immigration status, but other issues of diversity, sexual orientation, race. They're saying we're not sure if we still feel welcome, and what are you doing as leaders in the community to speak up on our behalf?
Well, how do you assuage their fears?
Well, two ways. So first and foremost, we directly address them, and so I help. Part of my job is I help draft that response as an organization. But what I so firmly believe is that it's not just an email response. We have to back that up with our actions and our behaviors as an organization. So that's why you see our CEO, Dr. Rod Hochman, vocally out there opposing things like the travel ban, opposing child separation at the border, in support of the DACA program. So we take that very vocal platform to ensure our caregivers that we stand in solidarity with them.
And that reassures your caregivers. They just feel they're more comfortable at work?
It makes them feel
or in general.
They feel what I would like them to feel. I don't want to speak for them completely, but what I would hope that they feel is pride in the organization that they work for.
I see, okay. And I know Providence St. Joseph takes care of people who may be in the country illegally. How do you do that?
So first and foremost, we take care of anybody who walks through our doors.
Right.
That is integral to our mission, integral to our heritage. It's part of who we are. So we never ask immigration status. That is not part of the healthcare experience. We believe that when you walk through the doors of our, whether that be a clinic or a hospital, that's a sacred encounter that is private. So we do take care of undocumented immigrants, but we never ask their status. Everyone is welcome at any of our facilities.
And so what sort of programs do you have for these folks?
So, when we do, people, because of the policies we are seeing, sometimes they're afraid to get care. They're afraid, and they wait till it's too late. So they seek care at the most expensive care setting, which is the emergency department, which in turn leads to a cost shift where all taxpayers actually bear the brunt of that cost. So we try to educate communities where we serve all people in those communities that our doors are always open. We have bilingual navigators that help patients navigate what care setting they should go to, that they don't necessarily need to go to the emergency department. If they're having a social service issue, we connect them with a social service worker. If they're having a mental health issue, we connect them with a mental health provider. So those services are all offered to everyone that we serve, everyone in our communities, regardless of immigration status.
How do you get that information out to them, though?
We partner. There's only so much that we can do. So we're a large organization, but we rely heavily on our community partners. So we partner with churches. We're a Catholic organization, but we partner with all denominations of churches. We partner with local charities. We partner with local social service networks. But it's really word of mouth. I have to say the churches have been a tremendous partner in getting the word out that services exist, not only healthcare services, but community-based services. And by offering these community-based services outside of the traditional healthcare setting, that's how we also advance health for a better world that I spoke of.
And are you seeing them take advantage of all of the programs you have, early on, and avoiding going to the emergency room?
We have seen that when we can get upstream on some of these issues that ultimately lead to a hospitalization or an emergency room visit, absolutely. People are happy, healthier, and in their homes, which is what we want. And that actually has the added benefit of being a lower cost to our healthcare system.
I was going to say, it serves everybody. It serves the people, and it also serves your healthcare system.
Exactly.
What's the procedure should ICE come into one of your hospitals and want to apprehend somebody who may be in the country illegally?
Well, we've had several instances and interactions with ICE over the last several months they have come into our facilities, and we do not allow them in any sort of private care setting. They're only allowed to be in the common areas. We ensure that they know about our policies around privacy when it comes to healthcare delivery, and that we can't really help them in providing any sort of information on an individual's immigration status because we don't know it ourselves.
Okay, and the reason you do that is why?
Because it's part of who we are. We take care of everyone, whether you're here legally or not.
Okay. It's just part of the passion of Providence St. Joseph Health.
Exactly. As I said, it goes back to our values, our values of justice, compassion, and dignity in particular. But we have worked in partnership with Customs and Border Patrol. We had an issue in one of our Southern California facilities where ICE was actually bringing in groups of detainees to our emergency room in shackles. We felt that was not in line or representative of the dignity of every human being.
Sure.
So we actually worked very closely with ICE or with Customs and Border Patrol and asked that when they bring in detainees that they give us a notice that they will be bringing in a group of detainees, that we can put those detainees in another area, that they bring them in unshackled, that they respect the inherent human dignity of them and in how they present them. And it's also not alienating when we have children in the emergency department and they're bringing in a group of shackled detainees who perhaps it has not been determined whether or not they broke the law at that point.
Right, yeah.
So we've actually had a very productive relationship and are grateful for our partnership with Customs and Border Patrol in really listening to the best way to serve the detainees who actually come in needing with healthcare needs.
Gotcha. And you've been really vocal about human trafficking related to immigration because a lot of people are coerced or taken, against their will from other countries. So, how do you identify people who go through the ER, that might be trafficked, and what do you do for them, and how do you know when to get involved?
So our footprint as an organization runs along the I-5 corridor. We have a concentration along the I-5 corridor, which is especially susceptible to human trafficking. So we launched a human trafficking system-wide initiative that helps train our frontline clinicians on the signs of human trafficking. So, and that's not actually trains not only frontline clinicians, but the entire staff of a hospital to say, here are the signs, here's what you need to be aware of. Research has shown that over 80% of human trafficking victims had contact with a healthcare professional. And sometimes that's the only outside contact that they'll have. So it's so important that people in the healthcare setting have the training to recognize the signs of a victim of human trafficking and then have the information to connect them to the resources that they need.
So that's how you help them?
Yes.
When do you know when to get involved?
Well, so we have certain specific training criteria that the hospital staff go through. And actually there's a story about, this was not one of our facilities, but this has been something that not-for-profit hospitals and Catholic hospitals in particular have been very engaged in. A story of a hospital system that they train their entire hospital staff to notice these signs. A young woman was brought in with a man who was suspected of trafficking her. And the nurse asked to take her to the restroom. While the nurse took her to the restroom, the janitor actually called the police because the janitor was even trained to recognize the signs of human trafficking. So when you have that holistic, all-in commitment to helping the poor and vulnerable or people that might be marginalized in this type of situation, every single person in our organization can make a difference.
Your CEO, Rod Hochman, who I've talked to in the past, has been very vocal about taking a stand and helping the less fortunate, a voice for the voiceless, as we've been talking about. In a recent interview, he talked about being the child of immigrants and why Providence St. Joseph Health is so passionate about being a voice for the voiceless. And we're going to take a look at that interview right now.
And last but not least, both of my parents were immigrants. So they came to this country in 1950. So the issues around immigration, what they mean to us, and what they mean to us as an organization are things that are very, very important to me myself. And just the thought about diversity and having a mom who graduated from the University of Rome Law School, she was one of the first graduates, you better think, the whole thing about respecting women, their role, their part of it was ingrained in me from the time I was about 10 years old. So I think those are all things that kind of form who you are and where you are today. So what I'm going to do in the next 20 minutes is bring you through what's the state of the world that we live in. And I don't know about you, but it's extremely stressful. I mean, every day I wake up and, the anxiety mounts in terms of what you see. And particularly in healthcare, we're in the bullseye every day. Someone's talking about what we're doing. And I have spent the last year or so just kind of advocating tirelessly with the CHA and with the AHA to protect what we believe in with our values and our mission and our vision as we move forward. But really being what I would say the voice for the voiceless. So that is, no more profound than when people wanted to take away coverage for Medicaid patients. And what I always remind people is that 50% of the babies that are born in the United States, almost 50%, are going to be born on Medicaid. And 70% of the seniors that are in nursing homes today are on Medicaid. So when that comes under attack and the right and privilege to have health is a right, not a privilege, we got to get activated and be out there. And I'm proud to say that I think Providence St. Joseph has done and kind of taken a lead in all of that area.
Ali, how does having a leader so invested in what he does impact what you do?
I think it's incredibly impactful. We are so blessed to have a leader that is so committed to social justice issues. So first and foremost, it raises our collective voice. It gives us that platform. Secondly, it empowers our caregivers. So as I mentioned, they feel proud. They know what we stand for as an organization, and they feel proud every day when they go to work. It really, really emboldens them also to speak out against injustice themselves. So we have Rod at the top setting this platform, and in my view, we should have 119,000 advocates on behalf of the poor and vulnerable, 119,000 people who are speaking up and being that voice for the voiceless, and Rod really sets the tone for that.
What sort of concerns do you have for your system, while you take a stand for immigrants, the way you have? I mean, it's a little controversial.
Absolutely, it's not without risk, and I say that the sisters were always controversial. If their view was if we're not being controversial, we're not doing things right, because the easy way sometimes is the less controversial way. So if it's controversial or not, we're still going to stand up for what's right, and we always lead and are faithful to our mission, our beliefs, and our values.
Right. Well, are there any concerns though that you have for the system based on this?
Not really. I mean, I've been doing the lobbying work in D.C. for a long time. We use, as I said, our values and our mission as a litmus test for what policies we will or will not support. And even though a public policymaker may be on the other side of an issue politically, they still understand that we are driven by our mission, that this is core to who we are, that we are standing on the shoulders of the sisters when we advocate on behalf of victims of human trafficking or immigrants. It's sort of nothing new. Maybe us being this vocal about it is new, but it's always something that's been part of our core beliefs and part of who we are.
And you've been okay.
Yes, so far.
Yeah, right.
Our mission is sustained for 160 years, and we believe it's going to sustain far into the future beyond that.
And Rod Hochman, your CEO, has been vocal on topics like children being taken from their parents at the border. How do you decide when to weigh in on something like this?
Yeah, that's a great question. I get that question a lot from across the organization. We really do use our values and mission as that barometer. So number one, is this policy in line with our values, mission, and who we are as an organization? Number two, can we make a difference? We believe with scale and size comes responsibility, that we have a responsibility to make a difference to advance health for a better world, and that includes things outside of just the physical domain.
So it's really a no-brainer then when you get involved in something like that?
These issues, it's a no-brainer for us. There are some more complicated issues, but these are so fundamental to who we are and what we believe that it's really a no-brainer.
Well, here's a complicated issue. It's Medicare or Medicaid, and as we know, Medicaid does not cover all the costs when a patient comes into your hospital. Is there a reason that Providence St. Joseph is pushing, to keep Medicaid? I mean, it costs you money.
It absolutely does. And Medicaid, we actually lost as a system $1 billion on Medicaid last year, but we're not in it for financial reasons.
Right.
We believe that health is a human right and that people should have access to quality care. When people have access to care via the Medicaid program in particular, they're more likely to manage their health conditions, engage in care management programs, which, as we discussed, keeps them out of the emergency room, keeps overall healthcare costs down. We've also seen that Medicaid and healthcare coverage in general boosts economic production. So when people are healthy and well, they're out in the community working. So Medicaid coverage, healthcare coverage is a win for individuals, it's a win for families, and it's a win for our overall communities as well.
And I was reading somewhere that the hit that hospital systems take is anywhere from -10% to -18% per patient. So that adds up.
Exactly. Yeah, nobody's in the Medicaid business to make money, at least not for-profit systems. We are certainly not in the Medicaid business to make money. We support Medicaid coverage because having people covered is the right thing to do.
Some states, such as Texas, where you operate, have not expanded Medicaid eligibility to low-income people, and that's caused some like smaller rural hospitals to either curtail their services or go out of business altogether. How's this affected you guys?
You know, so we serve 7 states. 6 of those have expanded Medicaid. Texas is the one who has not at this
Right.
point. We have seen an increase in health disparity, kind of a memorialization of health disparities for states that have expanded Medicaid versus states that have not. So we have seen outcomes in states where people have taken advantage of the Medicaid expansion to be much improved versus health outcomes in states where there has not been the expansion. We are blessed to have not experienced in our system hospital closures
Right.
due to that. But when you don't have people covered, when they lack health insurance, when that safety net is not available to them, it ultimately increases costs overall.
Right, and well, we're talking though about rural hospitals where people might have to travel, 4 hours maybe to get to Providence St. Joseph Health Hospital.
Absolutely. And again, this is the argument we make to our Republican colleagues too. That's an economic loss. There's an economic productivity that is lost when people don't have access to care. So they're either pushing off care needs, or they are taking time off to take care of a loved one who doesn't have access to care, or using that time to travel, 4 or 5 hours to get their healthcare needs met. And that's just not, we're a better country than that, Chris.
Well, there's also an argument, though, that Medicaid is likely to help prop up hospitals that are, inefficient and wasteful. How do you respond to that?
Well, I think like any large government program, especially one that's been around since 1965, we can always look for improvements in the program. And we certainly support innovations within the Medicaid program. We've supported the Medicaid waiver process, delivery system waivers, where those waivers allow states to redesign the Medicaid programs to specifically fit the needs of the individuals in that state. So we support innovation within the program. I think you constantly have to be looking at how to improve the program, how to redesign the program to most cost efficiently meet the needs of the people who use that program. So we still, as a system, we have Medicaid reimburses about 40 to 60% on the dollar. So hospitals are not using Medicaid as a windfall by any means.
We've talked a lot about giving a voice to the voiceless, and there are people watching and people who may not even be watching who would want to get involved in giving a voice to the voiceless. How do you help that community? How can somebody get involved and help you or help Providence St. Joseph Health do what you guys are trying to do?
I'm so glad you asked that question, Chris. I just heard a saying at my meeting earlier today. It said we may have gotten here in different boats, but we're all in the same boat now. And
Right.
that's kind of how we see it in terms of our collective society. So everybody has a responsibility to help improve the communities where they live. One way that we have opened up that opportunity to help be a voice for the voiceless is our grassroots advocacy hub, which can be found at on psjh.org. It allows our caregivers and, depending on the issue, other people within the community to weigh in directly with policymakers on these important issues that we've talked about today. Issues like immigration, issues like human trafficking, issues like gun violence prevention. So our grassroots hub has really provided that platform for caregivers to get involved and to carry this work with them. And it also, in several cases, is available to community members as well.
So this is an area that people can advocate and they can speak directly not directly, but through you to lawmakers?
Absolutely. They can speak directly to lawmakers. So it allows them to input. We have certain templates on positions that we have taken as an organization. If they would like to join, add their voice to that, they can send an individual letter to a lawmaker weighing in either against an immigration rule, in support of the Medicaid program, things like that. They can say, I live in Burbank, California. I'm very concerned about the safety and status of immigrants in my community. Will you please join me in enacting policy XYZ? And then it goes straight to their member of Congress.
And these guys listen?
They do. They do. I mean, they are elected by the people,
Right.
right? So they listen to their constituents. It's important for them to know what their constituents are thinking.
Mm-hmm. And there's a lot of people who think that sometimes, we go ahead and we contact our elected officials and they really don't care about what we're saying, but you're here to tell me that they, in a lot of cases, do.
Well, they have to care if they want to get reelected.
Okay. Is there anything that you'd like to add before we close? Something I've missed?
I would just add that I'm so grateful to work for an organization that takes standing up on behalf of the marginalized, standing up on behalf of the poor and vulnerable. They take that to heart, and we back that up with our behaviors and actions. And I'm really grateful for your time today and letting us
thanks.
talk about the ways that we've done that.
I think it's fascinating. I think you guys do a great job, and that's why I'm sitting here with you. This is Ali Santore. You're the Vice President of Government and Public Affairs for Providence St. Joseph Health, and we'll see you next time.
Thanks so much.
Thanks for coming.